something that it's severe. It's severe. They take it as that's how they live. With their belief, they think, oh, it's just maybe attention seeking, those kind of things. So it's like for the nurses now, for them to manage some, I mean, there are measures that they are trying to minimize the, this problem of self harm, of which some of the patient this who self harm, they will be on special observations, which is also uh, taking like pressure on staff. They have to use a lot of staff to manage those special observations, which becomes a challenge to nurses as well. So going through all these, sometimes if the nurses they are find that they find themselves to, like, the ward is not, they are not getting to where they are supposed to, they become angry. Some, they try to interact with these people. And the other thing that I've noticed is, like, they look at the stopping the self harm than going into the psychology to find out why is it that these people, uh, they cannot change whatever behavior, whether it's behavior, that activity of self harm, looking at the psychological needs, talking to this patient, creating that time. Some nurses, they don't have that time. They will just leave it to the support worker to manage, the patient, as long as they are on one-to-one, forgetting that there's a problem. Maybe there might be something in the patient that he needs to raise a concern, whereby maybe talking to them, they might come up to say, oh, it's because of this. So, and using those, like, using the special observation can be costly as well. Even changing staff all the time, maybe the staff are not enough, you have to use agencies. All those things contribute to increase the number of people who have come in that ward. Mm.
Right. So, right. Let me try to explain to you what happens here. Okay. The pressure of things, that's the reality of life. All right.
Mm.
There's nothing abnormal. No, that's the reality of life. And that's the way you're going to be working, or whether you are a nurse in a hospital or anywhere in the community or in mental health, the pressures are going to be exactly what you're facing. And that's the reality of life. Now, the reality of school here at your level is exactly the same. There's no difference at all. What you need is always you need to prioritize the things. That's all. Okay. You need to understand what you're doing. So now, when you're saying, okay, they have been telling us this confusion, this is as if they want us to do all these things at once. Because they have got a program. A program you were given right at the beginning when you started, that you're going to start from this day, you're going to finish on this day, unless there is circumstances which obviously forces them. We're more likely to be probably COVID-19 and lockdowns that we have got. That they might say, yeah, the government has said they need to do A, B, C, D. Otherwise, they can't do anything because it's going to be illegal. Because you also need to qualify and finish, yeah, so that they don't continue being paid just working on you. So that's the reality of life. But what you need is to prioritize. Now, my role here is to try to understand what you are learning and try to help you to explain so that you can understand, so that you can progress. I'm more of a facilitator than anything else. So there's literally not much I can do in terms of um, choosing or whatever. I'll always be asking you, and you shouldn't take things I'm telling you immediately say, yeah, this is what he said he did. No, my interest is okay. So this is what you're thinking, all right, and let's just think through what actually you are thinking, okay, and that
mm,
will help you to think better. And that's what my role is. Now, if I can't achieve that, it's so simple. I withdraw it completely. I withdraw from students because I can't make a difference. I can't help. Yeah,
mm,
that becomes problematic. It's not like you at a primary school or in a kindergarten where we are telling you what to do. No. Yeah, here you are adults, so we don't dominate. No, we are there to facilitate. To facilitate means where are you stuck? Okay, where are you? What is it that is creating a problem? So when you are coming to me, you are saying, okay, this is what I learned in class, and this is what I learned in the class. Yeah, the second day I learned this. Now I'm failing to understand how this link together. Yeah, that's
mm,
what you need to be thinking about. So then I say, oh, right, let's have a look. Okay. All right, this one, okay, you need to go this way. This one, you could go this way. Oh, this is the way you are stuck. Oh, this is the way to go. Okay. Or I will usually you will find that I provide so many different things and say evaluate each one of these and choose which one you think is better for you. Because what is better for me is not going to be better for you, right? It's even harder when I'm actually teaching maths because in maths I say, oh, this is a simple, but it's not a simple to that particular individual. So my sense is to try to understand your what you are coming from, right? So let's look at this topic because this topic now you're talking about primary research. Did they say you needed to do primary research? Because primary research means you do your own in research, where it means you have to design the research, you have to choose the methodology, you have to choose the sample, and then you have to investigate correct data, and then analyze the data, and then you produce the report. Now here you were talking of doing literature review, which means you are trying to pick the topic based on that literature review, whether that literature is still existing, okay, is up there, which is going to support what you are saying. That's what the evidence. So evidence already exists, and you're trying to identify evidences that are going to support what you are talking about, or they are going not to support what you are talking about. Okay, so that's what you initially were thinking. You told me. So
mm,
my interest is try to understand what you mean by cultural influences, because the way you have put it, so you can see cultural influences or necessary attitudes towards the people, okay, who actually self-harm. Now, when you start explaining this further, as I have quite listened, that's not exactly what you're talking about. And that's where I need to come in. See, okay, the way you have written this topic, okay, can we change it? That's
mm,
the whole thing you are talking, what I'm trying to explain. Because the
mm.
moment you will understand that, then it will be easier for you to move forward. If you don't understand, you can't move forward.
Yeah,
Yeah. And
yeah,
also learn that the project dissertations, you can't do all the things at one go. No, you need to
mm,
do little by little. And yeah, each day you must at least have a piece of that. By the end, you have put all the pieces together, and that's what makes your project and what makes your dissertation. There's no way you want to learn everything in a day. No, it doesn't work that way. No, it's a little by little. That's why you do it in a longer period. Okay,
mm,
so right. So let's take this in particular. Now, I emphasized um, um, in my feedback there. Okay, so let me read this. Okay, so I said I had a look at this. Indeed, as per your email, I do appreciate that studying is not as easy because it requires determination, commitment, perseverance, focus, and sustained motivation. And these are extremely important.
mm,
Whether it's even worse when you're doing PhD. Okay, but
mm,
I did masters myself, and before I did my PhD, right,
mm,
coming all the way from Africa, right, where I don't even know how to use a computer. Yeah, here come here say you can't submit work in written hand. Can you imagine how difficult it is? I've even never touched the typewriter. Okay, now should this prevent me to succeed? The answer is no,
mm,
because each of that I saw it not as a problem. No, and that's always what I tell students: don't see this as a problem, see
mm,
this as a challenge, because when you overcome it, you are
mm,
successful and you feel happy. Okay,
mm,
yeah.
mm,
So
yeah.
it didn't prevent me to succeed at all. I started with the that's a P. Where's the A? That A. Where is the? Yeah, I can't be looking there and then I'm typing. I can't. I even when I was seeing other people, they are actually talking on the phone and they are typing. I said, these are magicians. Yeah, they're not magicians at all. They have done that for years. Yeah. I said, what is wrong with these people? Hey, how can you say and they're talking? Hey, yeah, what do you want? Yeah, oh, yeah. Yeah. So but I said, no, no, no. This is a challenge
Mm,
because if I don't overcome it, it's going to make me fail.
fail.
Okay.
Yeah.
So I had to work hard. We start learning the computer. Okay. Until slowly, okay. Yes, I was writing. I can't even see where full stop is, where comma is. How do I put apostrophe? Yeah. But slowly, yeah, I got used, and then I moved on. I succeeded. Once I succeed, I feel great because
Mm,
I've achieved it. Yeah, what I wanted to achieve. So each problem you face should
yeah.
not see it as a problem. You should see it as a challenge, and they should be able to overcome it. So
Yeah.
you've overcrowded over this and that. Don't worry
Mm,
about it. Sometimes you find a supervisor with so hostile. Don't worry about it. Yeah,
mm,
don't worry about it. This is a challenge. I need to overcome this. So each day say, how can I overcome this so that I can succeed? You remain focused in what you want to achieve.
mm,
Yeah. The worst, if you are working in a hospital, the worst people to work with, yeah, they are surgeons. Surgeons are terribly, terribly, terribly difficult to work with. All right, until they become a mister. But
mm,
during the early part is, and it's exactly like that. Even in an exam, yeah, in an exam they can shout at you, but
mm,
if forgetting that you are in an exam situation. Yeah,
mm,
how do you know how can you diagnose like that? So then you feel shivering. No, don't shiver at all. All right. So that's the reality of life. So you need this focus. Yeah,
mm,
maintain your motivation
mm,
and make sure you can persevere and be determined, but also be committed. Okay. So as I said, what might help students of every day is obvious to assess their own strengths and weaknesses, and this is the problematic. Yeah,
mm,
I had a student yesterday who's doing a master's in your nursing there. He's struggling, and it's actually her brother who called me. Says, I'm totally stranded. Yeah, my sister, yeah, actually, is towards the end, is also doing dissertation. Okay. Now, as soon as you develop negative perception towards those other
mm,
people, then you
mm,
have anything that they talk to you, even if it's positive, it becomes negative. And
mm,
that's why I started with this student. Because I said, okay, send me the feedbacks that you had. They started blaming the lecturer, the supervisor doesn't want to talk to the supervisor anymore. So I said, they send me the feedback. I looked all through those feedbacks. Yeah, I said, okay, now I have discovered what is the problem with you.
mm,
It's you are failing to respond to the criticism that your supervisor gives you.
mm,
I don't
mm,
know what is the relationship between you. And this is what is the problem. I can't see anything wrong in what actually supervisor provided to you. Yeah. And
mm,
you look much with it. So he went to complain to the head of the module. The head provided the feedback, which is exactly similar to the feedback that he was given by the supervisor. But she thinks that is completely different from, yep, yes, these problems are there. So what you need to do is assess what is my weakness. Weakness can
mm.
be as simple as slow in responding to things.
Yeah,
Okay.
I am.
Yeah, if you're slow in responding to things,
Mm,
then it means you need more time because the idea is to develop a strategy. How
mm,
I'm going to survive here. Okay, that's what is most important. You
mm,
see, because if you don't understand your weaknesses, because I can see the way you are dressing. That's not the way we dress in Africa. Yeah, it's because when you came here, right, you knew that your weakness, you are coming from a hot country. Therefore, if you wear things that you were wearing in Africa, I'm sure you're going to die of cold.
mm,
Yeah. So what do? You develop a strategy so that you can survive. Yeah.
mm.
You end
Yeah.
up putting in this. Yeah, I was wondering why people are moving fat. No, it's because they need to protect themselves. So it's really important that you discover what your weaknesses are. It doesn't necessarily mean it's bad, no. But then you develop a strategy that will help you to survive. Accept all of us, we have those weaknesses. So it's extremely important. But also, when you're doing project or doing dissertation, you need every day you must do something,
Mm,
even if it's a single sentence, even if it's just two sentences, or
mm,
as simple as reading back what you had written yesterday.
mhm,
Try to revise because each time you are thinking it differently.
mm,
Okay. And this is what happens. When I was doing my dissertation, I could wake up in the middle of the night. Sometimes ideas come in the middle of the night. Yeah.
Mm,
As you move to the toilet, when you come back, I remember that thing. Oh, then I would take a paper, yeah, and a pen and then write. Always I had a small diary at the head of my at the pillow so that I can write any idea that comes. Don't say I'm going to write tomorrow. You forget. It goes.
mm,
And also learning as adults, you have so many commitments, so many things around you. Yeah, you have family commitments, all sorts of different things. Even
mm,
as simple as your neighbor. Okay, I don't want to let her down. She says there's a birthday for the child. What do? You leave everything. Yeah, you
mm.
go there. Yeah, or somebody is sick, is admitted in the hospital. I don't want to be called I'm a wizard. You're my witch. Yeah.
That's exactly one of our
Mhm. You
what is
see?
it? She's been sick in the hospital. I'm feeling guilt. I
Yeah.
need to cook for her.
Can you see? Yeah. So the more you start thinking in that way,
Mm,
can you see? You can't consider each time. Oh, she will be thinking, I'm a witch here. You know what's happening with me. You see, and or I'm selfish. God does not allow me to do that.
mm.
I've seen people hanging themselves for no obvious reasons at all. Why do you do
Oh,
that? Yeah.
uh,
So there are plenty of difficulties that you need to think about. Assessing those, they are extremely important. Okay.
yeah.
Now,